The time is 6:10. Most people are sensitive to the colder temperatures the winter months bring as a part of our Ask the Experts series. I spoke with a doctor at Bon Secours Urgent Care who says winter weather can bring its own set of health challenges.
The winter season is upon us, which means navigating colder days. Many people are sensitive to those changes in temperature, and they can play a direct role on the body.
A low temperature might decrease circulation because blood vessels constrict when it's cold, and you may feel that as tightness in your joints.
That's Dr. Matt Delfino. He's the Regional Medical Director for AFC Bon Secours Urgent Care. He says most patients report changes in the weather affecting their joints.
Some people who have had injuries to their joints specifically may have some damage to cartilage, and that may already be predisposing them to something like arthritis.
Those who already have arthritis,
the joint is going to be more susceptible to changes in things like blood flow or pressure, and so you may feel the effects of weather changes and the joint pain that you experience on a day-to-day basis.
Dr. Delfino says the cold weather can also impact your sinuses.
Changes in the pressure may cause your sinuses to expand or contract, and in your sinuses that can lead to headaches, and in your joints that can lead to pain or pressure type feelings.
Or people with allergies might notice the air a bit more dry.
For people with asthma who have irritated airways, that can lead to more wheezing or coughing. And so it can affect asthma, especially if you're outdoors a lot or exercising outdoors and you have asthma.
Or even if you're hibernating and don't get out much, pay attention to the potential irritants in your home.
You may get an increase of indoor irritants like dust, pet dander, and so without having fresh air circulating through the home, some people may notice that their allergies are worse.
Dr. Delfino suggests more routine cleaning, dusting, and vacuuming to somewhat mitigate those problems.
Make sure that you're paying attention to your sleep, your exercise schedule, and your diet, because getting enough sleep, making sure you're still moving, and you're not overeating or over-consuming alcohol can definitely help you during the winter feel better.
And practicing good hygiene to limit the spread of germs.
Make sure that you're keeping your hands clean, make sure that you're taking the normal precautions you would to avoid getting exposed to common colds and flus.
Dr. Delfino says if you cannot pinpoint if it's the cold weather that's impacting your health, visit your healthcare provider to get a better idea of what could be contributing to your symptoms. To submit a health topic for our Ask the Expert series, head to WSPA.com.